Schizophrenia therapy. 40 lessons for individuals and caregivers. Buddhist philosophy meets modern psychotherapy. Introduction. Schizophrenia is one of the most misunderstood mental illnesses, and at the same time one that occurs quite commonly in every population. Over the past decades, many scientific books, clinical descriptions, and specialist manuals have been written, yet there is still a lack of simple, practical materials that would guide the patient and the caregiver through everyday life with this illness in an understandable way. Modern psychiatry leaves no doubt. Antipsychotic medications are the foundation of stabilization, but on their own they do not bring a person back to life. Pharmacology calms the mind, reduces tension, quiets delusions and hallucinations, and makes the world bearable again. This is the first step, often crucial, because without it no lasting improvement can be built. However, medications work much like firefighters. They extinguish the fire, but they do not rebuild the house. It is psychosocial therapy, in its various forms, that determines whether the patient will return to life after an episode, to everyday functioning, to relationships, to working on oneself, and to a sense of purpose. Research from the last 3 decades, conducted by the WHO, APA, NIM and therapeutic teams in many countries, is very clear. People treated only with medication often struggle to regain activity, relationships, and independence. They often live in a state of quieting, but not fullness. Only therapy, regular, patient, and tailored to the needs of the person, opens the path to true remission. It teaches recognizing emotions, coping with stress, rebuilding concentration, managing risk, returning to social roles, communicating, building relationships, and working on identity. It is therapy that helps a person gradually rise from the illness, not only biologically, but in life. The statistics are unequivocal. People who combine medication with psychosocial therapy have fewer relapses, live more stably, feel more confident, and return to balance more quickly. Medication quiets the illness, but only therapy brings a person back to life. Without therapy, a person often remains in narrowed functioning. The day is filled with basic tasks, and life loses color and direction. With therapy, step by step, the rebuilding of relationships, self-worth, energy, plans, and hope begins. Most available information explains fragments, symptoms, diagnosis, treatment. These are usually materials filled with highly specialized language, difficult to understand for someone without medical training. What is missing are simple instructions, step-by-step guidance for situations such as a surge of anxiety, the beginning of a delusion, the appearance of voices, disorganized thinking, insomnia, early warning signs of relapse, a difficult day, or caregiver overload. In practice, it is precisely these everyday moments that determine the quality of life. That is why this guide was created. Its purpose is to provide specific tools that help understand what happens in the mind during schizophrenia, and to show how to regain control with gentleness, patience, and awareness of one's own abilities. Each of the 40 lessons is practical and can be applied immediately. It does not require specialist knowledge. It is a guide both for the person with the illness and for the caregiver. Both roles are equally important and complement each other in therapy. It is a shared journey in which understanding the mechanisms of the illness, recognizing warning signs, mastering simple stabilization techniques, and supporting each other can change a great deal. In this book, I use elements of Buddhist philosophy, not in a religious sense, but a practical one. Buddhism has taught for thousands of years how to observe the mind, how to separate thoughts from reality, how to cultivate mindfulness and balance. These principles harmonize perfectly with modern psychotherapy and are safe for people with psychosis when applied in a simple, stabilizing manner. At the same time, my experience with people suffering from schizophrenia shows that it is, in a certain sense, a disease of the ego. Buddhist techniques of releasing the ego reduce the frequency and intensity of psychotic episodes, while simultaneously improving the quality of life for both the patient and the caregiver. It must be strongly emphasized that schizophrenia damages not only the psyche of the patient, but also the spiritual well-being of their loved ones and friends. It is a very serious illness that destabilizes the entire environment of the affected person. Many years of experience with Buddhist techniques, which prove highly effective in overcoming addiction and depression, also apply both to schizophrenia therapy and to maintaining the mental health of caregivers. A person who has never had direct contact with someone suffering from schizophrenia usually has no idea how enormous a challenge caregiving is. Caregivers are usually unprepared for this task. They are family members affected by the illness, partners, siblings, children, or parents. Their first information about schizophrenia and caregiving often comes only at the psychiatric hospital, from the attending physician. Suddenly it turns out that they must face a Herculean challenge for which they are absolutely unprepared. They also seldom receive adequate support from medical teams, and after the patient is discharged home, they stand face to face with a demon that surpasses their abilities in every way. For this reason, I decided to publish a guide consisting of 20 lessons for the patient and 20 lessons for the caregiver, which is clear and simple, avoids unnecessary medical jargon, guides step by step, does not frighten, does not stigmatize, offers tools rather than theory alone, and can serve as a manual for everyday life. Many people live under the mistaken belief that all you need to do is give the patient strong psychotropic medication, which will disconnect them from the world and therefore cure them. Nothing could be further from the truth. Schizophrenia is not a curable illness, at least in the common meaning of the word. There is no medication that heals it. Antipsychotics help greatly in treatment, but the therapy itself is based on psychotherapy, not pharmacology alone. Creating an appropriate environment for the patient, establishing rituals, relaxation techniques, showing how to cope with mood swings, insomnia, etc., is more important than the medication itself. These tools give the patient practical means to fight the illness, and thereby significantly relieve the caregiver. Without proper support, the caregiver can easily fall into overload, exhaustion, helplessness, or chronic stress, which over time worsens the situation for both sides. A stable, aware, and calm caregiver can respond appropriately, maintain emotional distance where needed, and create an atmosphere of safety in which the patient can regain balance. In practice, this means that the therapy of the patient and the therapy of the caregiver complement each other. Every stabilization on one side immediately improves the condition of the other. When the caregiver is calm, the patient returns to balance faster. When the patient has clear tools, the caregiver feels less fear and stress. It is a system of communicating vessels, which is why working on the mental health of both sides is not only advisable, but necessary if therapy is to have real and lasting effects. It is worth mentioning that although the topics in the lessons for the patient and the caregiver are similar, the way they are presented differs significantly. Patients need one type of information and techniques, caregivers another. These are two different perspectives on the illness and two different challenges they face. This is why the lessons are separated and their tone differs, adapted to the reader so that understanding can be fuller and more effective. If you are holding this book in your hands, you are likely someone who is seeking understanding, balance, and hope. This is a good step. Stability begins precisely here.